Hi, this is Kegel8. This is the Kegel8 Ultra. It's one of the best-selling pelvic floor exercises in the UK. We recently did a poll of our women users, and one of the things we found was that quite a few of them were struggling to use a probe. Now, that might be for medical reasons. They either weren't able to insert the probe, vaginal atrophy, severe prolapse, or even hysterectomy. But they still wanted to do something about their pelvic floor. They still wanted to help to do something about incontinence. That's either bladder leaks or bowel leaks. So what we've done is we've set some more programs on the Ultra 20. So you've got many more programs that can be used outside of the body. Now, my mum uses this machine and she uses the little sticky pads, little sticky electrode pads, and it's absolutely brilliant because it works the pelvic floor. Let me show you how sacral nerve stimulation works. Here we've got a diagram of the sticky electrode pads actually placed at the bottom of the spine. What happens with the sacral nerves is your brain sends its commands to the pelvic floor, and all of the nerves come through the spine and through this sacral area here before going into the pelvic floor. Sometimes your brain and your pelvic floor get out of sync. If they get out of sync, that's when you start to get leaks and get accidents and you lose control of the pelvic floor. So what happens with the Kegel8 using its outside stimulation, remember, these little pads just stick at the base of the spine and they work the nerves and they work the muscles, and it's absolutely painless. It's really very effective. The clinical trials that we've seen for implanted electrodes, this is surgical implants that obviously ours sit on top of the skin, but for surgical implants between a 50 and a 90% cure and success rate. So we know that implanted electrodes work really well. So you don't have to have surgery. Now you can use your Kegel8 Ultra 20, simple. Stick it there at the base of the spine and let it reinvigorate the nerves. Let's get your pelvic floor back talking, so that when the brain says to your pelvic floor, oh, stop, I don't want to go for a wee, oops, stop, I want to be in control here, your pelvic floor will actually work and will keep control just as you need to. So remember, if you've got any queries about sacral nerve stimulation and how it can help you with bladder weakness, a few drips, even problems with wind, anything of that nature, anything to do with your pelvic floor, please give us a ring. Customer services are here 9 to 5 and we're always happy to answer your questions. This is a fabulous home treatment. It really will help you. And if you don't want to use a probe, if you can't use a probe, then it's a simple way to treat yourself at home with simple electrode pads.